Okay, so I've been kind of going off on this tangent lately where I'm looking for this quest to make everything in plastic surgery as predictable as possible. And this has been a mission of mine since I can remember. And there's certain procedures that have been around that we've sort of have accepted okay results. And for all of us as plastic surgeons, I'd go to a meeting, and whether it was my own results or someone else talking about it, there was always that looking at a result and saying, how can we make this better? How can we make these procedures more predictable and have less issues with patients, and make the nose, or make the hair, or make the neck, all of these things, these issues that patients see, so that patients who can get this can get the result they want as often as they want, as consistently as they want. So let's talk about what I've done. So the first thing I've done, I think differently, is using technology to really help me out. For rhinoplasty, it means I've been doing 3D imaging and I've really tracked my results. And so often I was using 2D imaging and kind of coming up with kind of a calculation. But now that I use 3D imaging, my calculations I think are even more accurate. And trying to get that accuracy with anything you do, whether it's a face, a neck, or a nose, you really want to have that at your hand, so you can really, if you can make your adjustments, these fine little adjustments to make sure that you're dialed in as much as you can. The second thing I've done differently again with technology is certain areas I would look at and say, how can I again make this better and more accurate? For example, for the nose, I use um, ultrasonic rhinoplasty now. And so what that means is I'm using a machine that makes minute millimetric changes that are done all under direct visualization of the nasal bones. Now, does that mean every nose is absolutely perfect? Absolutely not. This is a physical impossibility. But the consistency and the level of, um, uh, I guess, is from beginning to end of creating what you want is much more, um, it's even closer. You're dialed in just even that bit. There's a downside to ultrasonic rhinoplasty because my previous techniques, I think patients have less swelling, but for that small percentage of patients who'd have a slight edge, I'm seeing that way less. For um, hair grafting procedures, I'm using the Artis IX, which again, love the Artis 9X, but again, it's these slight subtle improvements where, although this new Artis IX, it's a massive upgrade financially, it is worth it for our patients because we're getting, again, better site making, better harvesting, and this is taking something that's already good, I mean, really good with the 9X, and making it even that couple percentage points better. And that's kind of the consistent theme I try to do with everything I do in the office. And so if I can use technology or any updates to make what I'm doing even better, even more accurate, I try to implement that. So my goal, with everything I do is to really analyze results and really try to make everything as, I guess, less deviations, less standard, less aberrant cases, and make everything as consistent as possible and as close to my plan as possible.